So my vision is that every patient, for every time they come in for an appointment here in the cancer program, has a positive experience. And I think as health professionals, we all aspire to that. And as a health professional, it is important that we are supporting all needs of our patients. It may not just be active treatment of chemotherapy or radiation, but we need to make sure that we're actually connecting our patients to the appropriate supports when they need to be.
The approach of palliative care is looking at patients and their families who have a life-limiting illness and looking after them as with quality of life being the primary goal. It affirms life, the palliative care approach, but it does not postpone death. It creates an environment where quality of life will be improved. It creates an environment where bereavement will be addressed. And most importantly, it starts early in the course of the disease. It starts at the same time as the diagnosis is made.
I think it's always hard to speak with patients and their families about palliative care. I don't think it's easy for any of us to speak with patients about that, and it's scary for the patients. I think oftentimes they feel like they're giving into their disease or there's no hope for the future.
It took quite a while for the diagnostic to come in because there were so many variables in my pain. Things just kept getting worse and worse until finally the doctor checked my files and saw no blood tests since April. So let's do another round of blood tests. They didn't mess around and came right out and told us you probably have blood cancer.
One of the things that disturbs patients most is fear. Fear of the unknown. Fear that they're going to be alone. Fear that they're going to be helpless. Fear that they're going to be hopeless, and fear that they're going to be abandoned. By addressing their needs, their symptoms, their psychological issues, their environment, you're saying to the patient, you are part of a team. We are there to support you. We are there to keep you as comfortable as possible for as long as possible. But death is not a failure. Death is part of the journey.
Advanced care planning is a process that involves individuals reflecting on their own values and wishes with regards to what they would like for their health care. That's step one of the process. Step two is really communicating those wishes to their family, to their friends, as well as their healthcare providers, and then subsequently documenting it, as well as identifying a power of attorney who would be responsible when someone is unable to speak for themselves or make decisions for themselves.
You know, the whole issue of advanced care planning is certainly in the forefront in our healthcare these days. And an interesting comment that was made from one of our family physicians is, she said, typically when the time changes, she always ensures that when her patients are coming into clinic, she always has that discussion about, have you developed your advanced care plan? Or have you reviewed it recently? Because it's something that families and patients want to have a discussion when they're well, to have that discussion, not when they're rapidly in health decline. That's too late. So that when they come into the program or as they're going through treatment, the entire team has the opportunity to understand what their advanced care plan wishes are and their goals of care. So it's important that we do it early.
When speaking to the differences of advanced care planning and goals of care and the palliative care approach, I do believe that advanced care planning should already begin the minute any disease that is chronic and life-threatening is made. That way, no definite time prognosis is given, but it does alert the patient and their family to the idea that sometime in the future the disease will progress, the patient's health will deteriorate, and it's something for them to think about. When one gets to the time when you ask yourself the gold standard framework question of, do you think this patient will still be alive in 1 year's time? Now you move on to the assessment and the prognostic assessment. You look at different factors of that patient's condition and then see, does this patient really qualify for more intense assessment in the home, for a treatment of his symptoms. And one can then alert the patient to the fact that it's now more necessary to try and establish what this patient's goals of care are. Do they have a will? Do they have a power of attorney? Have they thought about resuscitation? Where would they like to die? Those are questions that everybody should be thinking about. And once those decisions have been made, and once those forms have been completed, they can be placed in an envelope in a bottom drawer and not looked at again until the need arises. It's very traumatic for a patient's family to suddenly, when a patient is dying, ask for who's the power of attorney? Where do you want to die? Do you want to resuscitate? Research has shown and experience has shown that those patients that are prepared have a smoother transition and a more dignified death.
We have many resources within our Cancer Center program as well as in the community. So that includes our supportive and palliative care clinics, as well as professionals within the psychosocial oncology program. There are also patient education materials as well as websites such as Cancer Care Ontario that can provide information. And finally, we have several community resources that we like to liaise with, including home care services.
There are resources that Jean-Marc was able to benefit from, not only take care of his pain, but then to take care of his emotional issues, and then the physical issues, and then the constipation. So it was a whole body symptom management, not only just the pain. So cancer is bad enough to live with without having to live with all the side effects of the disease. So having the symptoms managed made this a whole lot better for, as a caregiver and just to be around Jean-Marc.
Pour moi, ça veut dire que je peux vivre ma vie. Avec du mal, c'est impossible de passer ma journée. Quand je suis arrivé, j'avais terriblement mal au dos. Je ne pouvais rien faire de la journée. J'étais sur des médicaments qui me constipaient plus, me donnaient plus de maux de ventre que de rien d'autre. Et puis aussitôt que nous avons réussi à avoir le Dr. Chasen, et on a établi une dose de morphine qui était suffisante pour contrôler le mal, eh bien, ça a été pour moi un gros changement, parce que de là, j'étais capable de commencer à relaxer, puis à me dire aussi, voir un petit peu de lumière, un petit peu d'espoir, qui disait, ouf, finalement, quelqu'un va contrôler le mal, et puis on va pouvoir avancer, puis commencer à faire le chemin de la remontée vers la santé.